Rack presses are pretty beneficial, especially for somebody who's limited in an overhead flexion pattern, meaning the arm has a limitation in moving overhead. So this is a good strategy to use while still in rehab to be able to press within a plane of the shoulder or the POS or within scaption, which is about 30 degrees or so from the horizontal abduction position. I'm using wrist wraps to help and decrease the damage I can place on the knurling, especially if it's a bar that is not of a doesn't have a high Rockwell density to it, and they'll just tend to kind of come off. And also using the wrist wraps to help avoid damaging the rack that I'm pressing on anymore if I have a rack present. Okay, I'm using a beginner bar here. This is what my patient was using earlier, so the weight's pretty light, but nonetheless, still, let's kind of walk through the position. So placing the wrist wraps against the bar itself, I'm going to take a small step back to make sure that I'm in the plane of the scapula. Much like a Smith machine, I'm going to go ahead and press into the rack and come down. Pressing into the rack and coming down. Now, as we've seen in the past, pressing into a rack or pressing into a wall, creating scapular protraction, helps to activate the serratus anterior. That helps to provide the proper control of the shoulder blade as it moves into the upward rotation position to clear the glenohumeral joint so that the arm can more easily gain an overhead position. Obviously, this is not the end exercise or end progression. This is just a midpoint of the progression to start having that individual get back into an activity where they're within an environment that's conducive for them to feel motivated to continue to keep succeeding, but also to provide them a means of gaining some additional benefit within a situation that maybe they're not ready to progress completely to, which would be the overhead bar position. There you go. Again, remember, think about wrist position, where you want the knuckles to be pointing. Good? Yep. And then think about symmetry since you're using the mirror.
I know, I was going to say.
Yeah, that one got a little asymmetrical. That one too. And again, you can try to back